Hi, I'm Dr. Bob with Carolina Value Pet Care. Thank you for joining us today. Today we're going to be talking about symptoms and treatment of allergies in cats. Now, if you are a cat owner, feel fortunate. We don't see near as many allergy issues in cats as we do in dogs. But still, when the cats do have allergies, gosh, they can be absolutely miserable. So we're here to give you some insights into allergies. And I have my lovely assistant, Shelly, today. She's going to be asking some questions, and hopefully you'll learn a lot and be able to make better choices for your cats going forward.
Hey, Dr. Bob, what are some signs my cat is having an allergic reaction to something?
An allergic reaction depends on, that's a pretty loaded question there. Allergies, and we'll talk a little bit about allergies and we'll talk about other things that can be sort of reactive to, but allergies in short, three different types of allergies we see in cats. Food allergies, seasonal allergies, and flea allergies, and all of those have a different means of trying to resolve the issue. If we actually see a cat with a reaction, we occasionally will see, gosh, it's so rare in cats, thank goodness, but occasionally we might see a cat that might even get like a vaccine, for example, and react in a way where they might get intestinal upset, vomiting, things of that nature. But or bee sting, for example. Cats can also be affected the same way people can and dogs can from an insect bite or sting. So when we're actually talking about a reaction to, like an allergic reaction, pretty wide scope of information there.
How will seasonal allergies present in my cat?
Yeah, seasonal allergies are typically seasonal, and I know that sounds pretty obvious, but when somebody brings a kitty to me, one of the first things I want to find out is how long has the problem been going on, and has this problem occurred in the past, and is there a pattern to it? Is there particularly a seasonal pattern, seasonal pattern year over year? And maybe it's the first time it showed up, but maybe it's the fourth or fifth time it showed up. And the more often it shows up, if we can see a pattern to when it develops, if it is in the spring or summer or autumn or a combination of those seasons, that is extremely valuable information to help us get a better understanding of the seasonality of an allergy.
How will my cat's allergies be diagnosed?
First and foremost, and again, a lot of the diagnosis comes from information that the kitty parent can provide to me, letting me know, is this problem been a recurring problem, and has this been about the same time each year? Because we're trying to get a better sense of is this a problem that's year over year, or is this a brand new problem? But again, we're trying to get a better sense of what the origin of the problem is. Then once we have the kitty on the table, we're going to take a look and see what kind of hair loss or sores or lesions or scabs or whatever is going on with this cat's skin, to give me a better sense of what the origin is. If I see problems primarily up around the head, the neck, the face, I'm always going to think food allergies first. If I see a cat with a lot of not necessarily hair loss, but a lot of scabbing from the neck or in the back end or above the tail, then we're always going to think either seasonal allergy or a flea allergy. And of course, and then we like to look at the belly of the cat. A lot of times people never look at their cat's belly, because unless their cat happens to be laying on the sofa and you just want to give it a little belly rub, and some cats like it, some cats don't. But if you happen to look at your cat's belly, or you don't, a lot of times they will be ripping. We've seen cats with horrendous areas on their belly where they're red and raw, and they've ripped out all the hair. But all of that's going to be information for me to give me a better understanding what's likely causing the problem in the first place.
How are my cat's skin allergies treated?
Two ways, primarily. First, obviously, we need to find out what is the source of the problem. And I say two ways. Depends on the problem. If it's going to be a food allergy, obviously, or if I suspect a food allergy, then first things first, we're going to change the diet. Okay. The three most common causes of food allergies in cats are going to be dairy, fish, and beef. That's going to account for the majority of food allergies we see in cats. If we suspect a food allergy, or if I suspect a food allergy, first, let's change the diet. Okay. If it's a flea allergy, with flea allergies, pretty simple. Let's get them an effective flea product, and we do carry a range of different flea products that actually do work, not like the crap you buy at the pet stores and such. And I like to give those cats a cortisone shot not for the fleas, but for the relief from the intense itching, biting, scratching, licking, itching, and chewing they're doing. And if they get a seasonal allergy, those cats typically, first thing I'm going to do is also give those cats a cortisone shot. And I should mention the cortisone shot usually lasts about 4 weeks to 6 weeks. So it gives them plenty of time to get some relief from the itching, which just takes a few days, but also to give them sort of continuous protection from the itching so they're not right back at ripping themselves again. We've got to get those allergies under control. Also with the seasonal allergies, at the very minimum, I'll encourage pet owners to start just taking a washcloth and water and just keep wiping their kitties down a couple or 3 times a day to remove any pollens, dust, things of that nature that could be triggering a seasonal or environmental allergy.
How can food allergies be treated?
Changing the food. But here's the problem. A lot of people think they can just change brands. They think it's a brand problem. It's not. This is an ingredient issue, so you've got to be intentional about what you change your pet to. Now, you can actually stay within the same brand of food. We just need to look for a different ingredient, a different primary ingredient that you're feeding it. And when I say primary ingredient, I'm talking about the protein. The vast majority of the allergies that we see in dogs and cats both, when it comes to food, is the main protein of the diet. In cats, it's primarily beef, fish, and dairy. In dogs, it's actually chicken and beef, okay? So if I got a cat that's eating a fish-based diet, then well, you know what, we're gonna try something. I like to try something a little bit more exotic with cats. I actually like to go with, like, believe it or not, a rabbit diet. That's pretty easy to find for the most part. Hopefully COVID hasn't created too many issues on the supply chain for the rabbit food, but I think that's always a good choice for most cats. But you gotta change the food. Second thing, if you have other cats in the house and they're going to get a different diet, then you're going to have to be very intentional about making sure your kitty that we suspect has a food allergy cannot get access to your other cat's food. Third, if you got a cat that goes outside, you know, we're kind of rolling the dice, because if your cat likes to roam the neighborhood and might find another food source, well, that can be a little bit out of our control. Unless you've got some neighbors that, like next door neighbor, they're putting some food out to get in good graces with your kitty. Just have a conversation with them, or just give them some food that you can say, here, I'm going to give you the food. This is what he can eat, or this is what she can eat, and let them put that food out. So there are ways of getting around that, but the key thing is you just have to be very intentional about what they consume.
Can I give my cat Benadryl?
You can. I don't know why you would, but basically, it almost never works for cats, and typically we have to give them the liquid, and good luck, because it tastes pretty bad for cats, and you're probably going to get just prepared to have some Band-Aids and a first aid kit handy if you're going to try to give Benadryl to your cat, but basically, no, it almost never works for dogs. And again, I just would never recommend that for a cat. Yeah, you can do it, but why would you?
Are there other allergy medications my cat can take?
As far as, well, I'm going to make the distinction between something that you would give at the house, and I would say no. Something that we give, yes, we actually, as I've mentioned a couple times earlier in this conversation, the use of cortisone in the form of an injection, so you don't have to be giving pills, because obviously that can be problematic for some kitty owners. But the injection typically lasts about 4 weeks to 6 weeks. So again, these kitties would get significant relief over that period of time in the vast majority of cases. So can you give medications? Yeah, but again, I wouldn't recommend it. Anyway, so hopefully that's going to give you some insights into allergies and symptoms and what we can do to treat your kitty. And if you have any questions, or reach out to us through CarolinaValuePetCare.com, and we hope to see you soon. Thanks.